Hello and welcome to Med4 Care. I am Dr. Care and today we will talk about neck pain. Well, let's not waste time and let's start right away. Let's start with the description of the phenomenon of neck pain. It can also be defined as neck pain, and it is a very common symptom in the population and manifests itself with more or less prolonged painful episodes in the nape and neck region. In most cases, neck pain does not last long and tends to resolve spontaneously. In other situations, however, neck pain can become chronic, and in these cases relief is only obtained with targeted therapies. According to a recent study by the Global Burden of Disease, neck pain records a very high incidence in the world population, ranking fourth among the major causes of disability, significantly limiting the quality of daily life in those who suffer from it. Furthermore, neck pain is more prevalent in women and occurs mostly in the middle age groups, often appearing in association with other symptoms, such as headache, back pain, and depression. Now let's talk about the risk factors and the causes that trigger neck pain. In most cases, cervical pain is attributable to traumatic events or tensions affecting the muscles of the cervical region, or distortions of the longitudinal ligaments of the cervical vertebrae. At the base of many of the episodes of neck pain, there are therefore conditions of stress or real trauma, at the level of the muscle tendon structures that surround the region of the neck and the region of the nape. These conditions can originate from direct trauma to the head or neck, typical for example in car accidents, or competitive sports such as rugby. It is important to emphasize that posture also greatly influences the development of neck pain, since many individuals tend to assume an incorrect postural attitude in space, not respecting the correct curvature of the neck, defined as cervical lordosis. The risk factors associated with the development of persistent neck pain can be linked to a lifestyle spiced by bad habits such as smoking or a lot of sedentary lifestyle. Furthermore, there may be a particular genetic predisposition at the basis of cervical pain. After talking about the origin of cervical pain and the risk factors that can trigger it, let's face the classification of neck pain itself. The first method consists in examining how long the symptoms have been present, thus distinguishing the different forms of cervical pain. Acute when it occurs for less than 6 weeks. Subacute when it occurs for less than 3 months. Chronic if its clinical presentation exceeds 3 months in duration. The second method sees a distinction based on the pathophysiological nature, in which we identify 2 types of cervical pain. The first is mechanical neck pain, due to injuries affecting the muscle tendon structures of the neck or to pathologies of the vertebrae and joint facets, as in discopathies. The second is neuropathic neck pain, secondary to diseases that target the peripheral nervous system, due to stimulation of the mechanical or chemical receptors of the spinal nerve roots. Making the distinction between neck pain of mechanical origin and neck pain of neuropathic origin is very important, as it allows you to assign a specific treatment to the condition for the resolution of symptoms. Several symptoms can be very frequently associated with neck pain, such as headache, balance disorders, stiff neck, nausea or vomiting, and also with alterations in sensitivity, such as hypoesthesia and paresthesia in the cervical area. If you feel a pain that can be traced back to neck pain, for an optimal evaluation you must rely on a specialist doctor in the sector, such as the physiatrist or orthopedic doctor or a pain therapist. An accurate medical history allows the specialist to collect a lot of information from which to infer the etiology of cervical pain, differentiating it first of all into mechanical pain or neuropathic pain. In addition, the doctor also inquires about the patient's general state of health, linking his work habits, concomitant illnesses, medications taken chronically, or a possible sedentary lifestyle to the genesis of neck pain. The patient's physical examination focuses instead on the general state, paying attention to the expression of signs indicating pain on the face. In torticollis, for example, facial expressions of pain are often accompanied by unnatural bending of the head forward. Generally, the diagnostic process that leads to a precise and timely diagnosis of neck pain already certified during the physical examination uses the following tests. X-ray of the cervical tract and the acromioclavicular joint, sufficient in itself to make a diagnosis in the event of structural pathologies such as fractures, scoliosis or spondylorthrosis. Nuclear magnetic resonance, very sensitive examination to detect abnormalities of the soft tissues of the cervical region or to carry out a timely evaluation before a scheduled surgery. Let's now deal with the different methods of intervention in a patient with overt neck pain. This strategy includes certain physiotherapy exercises that can be effective in the case of neck pain associated with back pain, probably originating from bad postural attitudes assumed in space. The conservative medical strategy involves the use of pain therapy for the control of cervical pain. Medicines can be used by mouth or placed on site, with mesotherapy or infiltrations. In the case of therapy with drugs at the local level, there is the possibility of injecting particular classes of drugs into selected points within the cervical region, called trigger points. Anesthetic drugs or corticosteroids are injected into the trigger points, which demonstrate good efficacy in pain control in the short and medium term. The surgical strategy, although it is more invasive than other therapeutic solutions, often has a definitive value, as it frees the patient from the painful experience and also brings a significant increase in the muscle strength found. We are now at the end of today's video. We hope you enjoyed it. If you found it useful, please support us with a nice like and subscribe to the channel. See you soon on Med4Care.